Welcome, nursing leadership students. This short presentation will provide an understanding of how conflict resolution is managed between nurses in a healthcare setting. Before jumping into the case scenario, let's explore our topic, interpersonal conflict. Interpersonal conflict usually occurs between patients, family members, nurses, physicians, and members of other departments due to differences of opinion, priority, or approach. Interpersonal conflict becomes heavily subjective when the involved feel that their sense of belonging, self-esteem, moral, or ethical values are threatened. This type of conflict is most commonly experienced by nurses in the workplace. An example of a common type of interpersonal conflict is disagreements in determining how much information is necessary for patients and families to have about their illness. We are now going to jump into our case scenario.
Our case scenario involves a new psychiatric nurse, Rashna, and a senior psychiatric nurse, Karen, experiencing interpersonal conflict with regards to patient care. Rashna wants to advocate for best practice, but Karen argues that she has done things properly for the last 15 years. This presentation will discuss the different points of view of the new nurse, the experienced nurse, and the nurse manager. Then we will discuss the different types of conflict resolution, the action plan on how to reach a collaborative approach, how to follow the flow of communication when resolving conflict, and finally, whether the conflict was effectively or ineffectively resolved.
As a new nurse, I've been taught the importance of best practice and advocating for clients to be treated with kindness and respect. When I heard Karen using derogatory language to describe Mr. Way, I felt it was important to discuss my concerns with her, as this type of language can contribute to stigma. However, when addressing this issue, I felt Karen wasn't listening to my perspective, and as such, I felt uncomfortable to voice further concerns. Therefore, I did not have the opportunity to explain that clients struggling with substance misuse often need a higher dose of pain medications to have the same effects. I failed to address this with Karen during our initial conversation, but I brought it up to the nurse manager.
As someone who has been a practicing nurse for the last 15 years, I have learned how to accurately document and describe my patients' verbal and nonverbal behaviors. I chose to administer the lowest dose of hydromorphone to Mr. Way as he is an older gentleman in his 50s and is frail for his age. As this was my first time working with him, it is best practice to start with the lowest dose ordered and increase as necessary. I feel my language was justified based on Mr. Way's presentation and history of substance misuse. It is important to document these findings because his treatment plan encourages substance use management. I felt conflicted by providing him more pain medications as this could exacerbate his illness. I believe med seeking is appropriate in this situation because he continued to ask for more pain medication and has a history of substance misuse. I acknowledge that the use of the word junkie is not the most appropriate, but I did not chart this.
As a nurse manager, I'm often faced with resolving conflicts between staff members. I always encourage staff to follow the flow of communication by first speaking amongst themselves. However, when matters remain unresolved, I become involved to help mitigate conflict. After speaking with both Rashna and Karen separately, I felt the priority actions were to address respectful dialogue between our nursing staff and the language used regarding clients in our care. I felt this situation was a good learning opportunity for Rashna because nurses need to effectively communicate with each other. This was also an opportunity to encourage Karen to be open to new ways of caring for clients. Therefore, I informed Rashna that when communicating concerns, tone is important as this can be misinterpreted. For Karen, I encouraged her to be mindful of the language she uses while at work. Although her experience is valuable, nursing practice is constantly evolving. I believe taking this approach is a fair solution for each nurse. I provided feedback to both Rashna and Karen as there was room for improvement on both their parts. It is important to promote an environment that is enthusiastic, disciplined, and where nurses feel confident in their team. These are crucial aspects of a functioning unit and are the building blocks of team morale. Initially, the team morale was low as both nurses lacked confidence in one another's judgment. My goal was to boost team morale by accommodating both nurses' perspectives.
When looking at the different types of conflict resolution, there are 5 different ways to handle conflict. The first is avoiding, where the conflict is postponed or prolonged. The next is accommodating via obliging, which involves self-sacrificing and obeying orders or serving other people. Competing via dominating is another form of conflict resolution and involves pursuing one's own needs and goals at the expense of others. Compromising is where all parties create a middle ground. Lastly, collaborating via integrating is a creative approach where a group of people work together to achieve a common goal. However, with collaborating via integrating, this form of conflict resolution can be time-consuming, but has been known to be the most effective.
This completes our visual and audio presentation. Please refer back to our PowerPoint and answer the questions related to the case study using the discussion post found in Blackboard.